Welcome to the Voices of Healthcare Equity. I'm Kim Tranquata, founder and CEO of the Healthcare Alliance for an Equitable World, and your host on this journey. Our organization, driven by clinicians, is on a mission to address global healthcare inequity using telehealth solutions. Together, we're building a community of healthcare professionals committed to making a scalable impact on global equity. Join me in insightful conversations with global health innovators as we explore the current and future state of healthcare. Be a part of this mission. Let's create lasting change together. Today, I have one of those innovators in the future of healthcare with me, and it's my pleasure to introduce Luká Yancopoulos. Luká is a visionary entrepreneur and the driving force behind Grapevine, a groundbreaking startup transforming the healthcare supply chain landscape. The platform developed by Luká and his team enables clients to save up to 50% on medical supply costs, reduce order times by over 90%, and seamlessly work with multiple vendors, thereby accelerating procurement and delivery processes. It's my pleasure to welcome you to the podcast, Luká.
Thank you very much, Dr. Kim. I'm very excited to be here.
This is fun. This is an exciting and fun conversation. You know, healthcare is super complex, and there's so many parts, including supply chain, that someone like myself, a physician, does not necessarily pay attention to unless you're in the business of running healthcare and running your own practice. So I think this is an amazing and very important conversation. Before we begin, Luká, do you have any affiliate disclaimers or need to identify any conflicts of interest?
No, I do not, at least not that I know of.
Awesome. Well, let's get started. You have an amazing origin story about your background and how you became involved in healthcare supply chain streamlining. Introduce yourself and please share that. It's a wonderful story.
Yeah, absolutely. So I'm a big believer that necessity is often the parent of innovation. And in my sort of world, my entrepreneurial journey, I got called to action by something that was, weighing on my shoulders, a fear, if you will, and an uncertainty of the future that was swirling around the landscape of COVID. I was a college student, quarantined up in my dorm room with some of my buddies, and COVID breaks out. My mom is a nurse practitioner. My dad's a scientific researcher working in medical research labs, and you know, we were hearing and seeing the impacts of healthcare supply chain failure on the people that we loved and that we cared about, and the frontline heroes that everyone was rooting for. We decided to, from our dorm room, to start compiling data from databases that the US government makes available to the public, like the FDA medical device database, showing the licenses of different manufacturers or importers, and then import records showing what's going through customs. And by overlaying sort of the licensed providers of supplies, if you will, with the real-time sort of importers of supplies, we were able to sort of find, using this data, verified inflows or in-streams of medical supplies into the United States. And this is at a time when, my mom being told to wear the same N95 mask for 2 weeks in a row, right? I'm hearing horror stories about physicians wearing garbage bags in the operating room because the show must go on. And it was something that was scary. So we didn't really start a business as much as we started a solution to a problem that we were seeing in real time. And yeah, we just connected these frontline workers, these healthcare practices, to the sources of supplies to see if we could help. Again, there was no business. We were not making money, didn't plan to make any money. And it wasn't until a month later when we end up getting a call from these frontline workers, their supplier, a big supplier in the space, a very old company that does hundreds of billions of dollars in revenue and sales of these supplies. We get a call from one of these major distributors saying, "Hey, we hear you're, servicing our customers with the supplies you need. We'd like to start purchasing supplies from you." which blew our minds because we didn't think of ourselves as suppliers in any capacity. We quickly jump on LegalZoom, make an LLC, set up a bank account, and we started receiving orders for literally millions of masks, hundreds of thousands of dollars coming into our bank account. And, our goal was to reinvest that to scale this impact, this software solution that we were starting to build, and continue to deliver sort of pandemic relief to as many frontline heroes that we could. So we reinvested every dollar, grew it pretty big, and delivered more than $20 million of medical supplies. Took home nothing at the end of that project, and decided to go back to school to finish school. But as we were starting up school a year later, it was weighing on me that one of the biggest companies in the history of the world, right, started sending hundreds of millions of dollars to kids in their college dorm room. And that's like the reality that we lived in. That bothered me. It really irritated me. And we, with a step back and a moment to breathe, we went to the drawing board and tried to dissect what was so wrong, what created the opportunity for us, and how we could rebuild things from the ground up using modern technology and infrastructure to make a really big impact, not just relief during a pandemic, but a game changer that would outlast disruption events and whatnot, and make sure that something like that would never happen again. And that was sort of the birth of Grapevine, was that revamp, or that fresh start.
That is the best origin story for a business. You didn't set out to find a market. You set out to solve a very real problem in real time, and with a very real solution, the market came to you. That's the best origin story ever. Luka, I think we should maybe explore a little bit what those issues were during COVID. Because like you said, it's part of why your solution is so important, but it's also part of why it continues to be important, because disruption events will always happen. Disruption is normal, and it helps for us to reflect and learn from the disruption events instead of just kind of marching on and going back to the way it was. So from my perspective as an emergency physician, holy cow, yes, we were given N95 masks, which we all were familiar with because these are the masks you use for tuberculosis. And throughout our medical training and all the decades before that, you would use it. You'd go into a room, wear this very tight fitting mask that seals out airborne pathogens. And as soon as you come out of the room, you put it in the trash, because now it is contaminated with the virus on the outside, and you don't want to bring it back to where you're documenting. You don't want to bring it to another patient's room. You don't want to really carry that virus around to multiple places. And when COVID hit, we were told to forget everything. Forget everything you've learned about how to use these masks, how they were designed to be used. They were designed for single use. And because the supply chain is disrupted, you're going to wear it for an entire shift. You're going to never take it off in order to prevent surface contamination. You're going to wear it into multiple rooms. And guess what? You're actually going to wear it for 5, 6, 7 days at a time, and just put it in a little brown paper bag in between 12-hour shifts. So that's the problem. So first we defined the problem. That was the problem we were dealing with. And it was a problem not just for healthcare workers, right? So if you give all your healthcare workers a deadly virus and they are either incapacitated while they're recovering or they die, you don't have healthcare workers to care for your population. So number one. Number two, reusing infectious disease supply leads to spread of infection to other people, patients, other healthcare workers, et cetera. So it's super important that we kind of define the problem. And Luka, you probably heard it from your mom and knew the terrifying fear she was living in not only herself becoming infected, but bringing infection to other people, including the innocent people you have at home that are quarantining, other people you are in contact with. And you sitting in your college dorm, we're like, let me use whatever tools I have to come up with a solution. Tell me what you found out about what the failures were in the healthcare supply chain that led you to your solution.
The way that I think about there's two classes of sort of problems or failures that we uncovered during, our foray into healthcare supply chains in that first sort of project. I called them vulnerabilities and inefficiencies. Inefficiencies lead to exorbitant costs that both patients have to pay, right? But as a result of upstream inefficiencies of the practices themselves paying, right? So huge costs for supplies that should be a fraction, I believe, 1/10 of what of what they are for the healthcare practice, and in turn, it should be lower cost for patients, and those costs or reductions or savings should be passed forward. So there's inefficiencies, and then there's vulnerabilities. Vulnerabilities are more of the sort of the results or lead to the disruption events that you were talking about, Dr. Kim. Things like a lack of supplies, a change of clinical behavior, right? Calling off, canceling, or rescheduling surgical operations. Like these sorts of supply chain vulnerabilities lead to those sort of events, not just high costs, but real changes to behavior. So as far as the way that we dissected those, and I'll start with the vulnerabilities, right? We call it a supply chain, and there's a very famous quote or mantra about chains, and chains are only as strong as their weakest link. Unfortunately, most healthcare practices or physicians or even hospitals, right, depend primarily on a single upstream supplier for about 90% of their spend. We work with huge hospitals, right? 10, 20 locations. We work with oncology institutes that have hundreds of locations. And they're still very often, yeah, they're maybe registered with 3 or 4 suppliers. Yeah, they've got a GPO, but 95% of their spend and their actual ability to purchase from suppliers is with one major distributor, typically a McKesson, a Cencora, maybe a Henry Schein or a Medline. And that makes you very vulnerable. If you're dependent on one link, you are a true supply chain, right? And that link breaks, meaning McKesson runs out of supplies, then you are left empty-handed. And in that moment, you are scrambling to find new suppliers, doing everything you can to look for, new sources that may be able to fill the gaps that have been created, right? Now, the way that we sort of approach trying to solve that problem is turning a conventional linear supply chain that is, only as strong as its weakest link into more of a network, right? When one link goes out, we just swap in a new link. Another link goes out, swap in a new link. So making suppliers easily interchangeable while procurement personnel or office managers, whoever it may be, sort of do their shopping, right? Connecting you with a broader network of suppliers that can be all sort of shopped, compared, and redirected in the same screen. And this is not something that's isolated. These vulnerabilities are not something that is isolated to times like COVID. They're constant, right? Back orders are constant. Local shortages are constant. And what people don't realize, they think it's very often a national shortage, but 90% of the time that a medical practice can't get what it needs, there's a warehouse in the nearest city that has exactly what you need, the same exact item from the same brand, same manufacturer, and you just haven't connected it with them yet. And even to find and validate and know that they're legit is a whole process, right? So even in that moment that you realize there's a shortage, at that point it's too late because it's going to take you weeks to vet out these new suppliers, fill out a credit app, get your net terms, and so on. So those are vulnerabilities. Inefficiencies, on the other side, are things that, when all is right, healthcare practices are paying way too much for supplies, right? Even when those items are in stock, even when your chain is taut and strong and no link is going down, you're still overpaying massively by supplies. And there's a couple of causes of that. One is intermediation, right? Think about what was going on when McKesson started ordering from us, right? A healthcare practice was ordering from McKesson. McKesson was ordering from Luká Yancopoulos and Pandemic Relief Supply was the name of our company. Pandemic Relief Supply was marking those costs up and ordering it from another reseller who's ordering it from a manufacturer, right? There's 4, 5, 6, sometimes more, 10 intermediaries in between. And it's not just the markups, like, individual companies or corporations marking those products up to make a profit, but moving things between these intermediaries whose warehouse, right? Like A to B to C to D. We all like to think of this idea of free shipping, but there's no such thing as free shipping. It costs someone something every time you ship it. And when you have 5, 6 intermediaries, it's getting marked up to cover costs of shipping between warehouses, costs of operations, for the businesses. And by the time it gets to the end customer, it's already been sold and resold 10 times, which is insane. So disintermediation is a big part of what we believe in and what we do, but also optionality, right? Imagine you had a single store that you had to buy everything at, Dr. Kim, like in your own personal life, like any person listening to this, everything you bought, your milk, your clothes, everything had to be bought from a single store. They would have a monopoly on your bank account.
Hashtag Amazon.
Hashtag Amazon. If you go nowhere else, you don't see that there are cheaper prices elsewhere, right? So you need, in a healthy world, people to compete for the dollars that consumers spend. And similarly, we need to hold distributors and healthcare suppliers accountable by letting them compete against one another in a fair ecosystem. And these 250-year-old companies that do $300 billion in revenue, right, owning half of every dollar in healthcare spent, are honestly gross. Like we gotta do a better job as healthcare providers, as spenders of dollars, as patients, to demand that, people compete for the dollars spent in healthcare, and they do race to the bottom. So that way our healthcare costs can go lower and healthcare can be more equitable to people and more affordable to people.
Luka, I never thought I could be so excited about healthcare supply chain.
Well,
this is excellent. I'm like, whoo, I'm so excited. I'm fired up about healthcare supply chain.
I think it is important for doctors like yourself and leadership in healthcare to focus on direct patient care. So like, I don't blame by any means like physicians or healthcare leaders for sort of the lack of forwardness that has been implemented in healthcare supply chains. But I think it is the responsibility for someone, not doctors, but someone to come in and to prioritize advancing these systems that are very outdated and bringing sort of a revolution to the way that healthcare supplies, pharmaceuticals are delivered to both physicians and of course, patients.
And look at disruption in supply has not gotten better since COVID. It has gotten exponentially worse. It is not a week that goes by that I do not get an email about some medication that we use on a regular basis, whether it be a pain medication, an antibiotic, a numbing medicine that we use for procedures, is not in supply. And we are scrambling to come up with a different way of carrying out medical care. It has not gotten better. I've only seen it get exponentially worse. You're also talking about emergency preparedness. I mean, this is something our government needs to be doing and forward thinking about, right? Because we saw in COVID, this isn't a one place disruption. You are right. The problem with chains is they're linear, very linear. One step leads to the next, and you break a link in the chain and the whole thing falls apart. And you've disrupted that and turned it into a network with lots of options, right? An algorithm with tons of options. Disintermediation, super important. So yay. Let me just point out, this is Emergency Preparedness 101. This makes not just a single healthcare practice more stable, it makes society more stable. It makes entire governments more stable. Entire governments can topple because of this kind of management of critical infrastructure, and healthcare is definitely critical infrastructure.
I couldn't agree more, Kim. And the way these things intertwine are incredibly complex, but also, quite beautiful in that being vulnerable, right? And being inefficient, they're very related. If you depend on a single, let's just call it like an intermediary, like a McKesson, a Shine, a Medline, whatever, for your supplies, think about how many sort of degrees of communication need to occur for a manufacturer to increase rate of production, right? To respond to a spike in demand, right? It's not it's not that the patients are getting sick. So now we increase, no, manufacturer has no idea that the patients are getting sick yet. It's not that the doctors and the medical practices are purchasing more supplies at this point. Still, the manufacturers have no idea that there's an increased demand. It's not when the distributors come to my former company, Pandemic Relief Supply, and start ordering more. No, it has to go through 10 rounds of purchase orders and days, weeks, months of communication in order for the manufacturers to even start ramping up production. So the closer you can bring the ends of the supply chain together, that is obviously beneficial in disintermediation. And the ability to sort of handle and work directly with as many suppliers as possible is also a benefit that makes us, gives us greater optionality, drives down prices, and makes us more prepared to handle disruption events and shortage and emergencies.
What an amazing first half of what's even going to be an even better second half conversation. I mean, we really brought home what the issue is and why medical supply chain is critical and what the issues were and are that made a company like Grapevine highly necessary and a leading innovator. I'm excited to continue our conversation and really excited to have Luká Yancopoulos here with us today.